Good morning. Today is Thursday, March the 11th, and this is our weekly COVID-19 update briefing. As of today in Bossier Parish, unfortunately, we're up to 13,110 positive cases. That's an increase of 62 since our report last week. And also, we've had 11 more deaths since last week, bringing our total to date to 275. As a matter of interest, the statewide deaths are approaching 10,000. We're now at 9,812. At his press conference Tuesday, March the 9th, Governor Edwards announced that we were moving in the right direction and have been doing so for several weeks. We have met the federal gating criteria, which permits us to move to phase 3 of the recovery, and that's effective from March 3rd through the 31st of March. And also, in the state's most recent percentage of positive cases, at the end of February, we were down to 3%, well below our goal of 5% or less, and that's a tremendous improvement over the last 2 or 3 weeks. From the Louisiana Department of Health website, the COVID-19 vaccination eligibilities effective Tuesday, March 19th, in the state of Louisiana has expanded significantly as far as eligibility to get the vaccine. And it includes people who have health conditions that may result from being in a high risk of disease and so on. And the new changes are if you are between the ages of 18 and 64 or 16 plus if you're receiving the Pfizer vaccine and have one of the following conditions, you're now eligible to receive the COVID-19 vaccine. And if you're pregnant, regardless of your age, you are eligible. These new categories of eligible persons are as follows. By age or condition, people 65 or older, dialysis providers and patients, and pregnant individuals. Then the next category is people with certain medical conditions. And most of these have already been completed. There's 21 different categories here, and I'm not going to repeat them all because many of them are repeated, but I would point out that people in this category and have at least one of the following conditions, they are eligible now to receive the vaccine, and I would remind you that you should complete the Louisiana COVID-19 vaccine attestation form before your appointment. But these include such things as people with cancer, chronic kidney disease, heart conditions, obesity, current or former smokers, people with asthma, hypertension or blood pressure, chronic liver disease, being overweight. There are several others, but that's just a sampling of the new categories that have been added. The eligibility for the vaccination by workforce, most of these also have been previously approved, and there's 18 different ones. And again, I'm only going to point out 2 or 3. You can get a complete listing through the Louisiana Department of Health, but in this workforce category is health-related support personnel, and that's such people as lab staff people or mortuary staff who have had contact with corpses, and etc. Teachers have been added, and other support staff working in K through 12 or daycare, and staff of congregate living facilities, such things as nursing homes or incarceration facilities, are now eligible. The Food and Drug Administration recently approved the Johnson & Johnson vaccine, and this is a tremendous assistance to the potential to get your vaccination in a timely manner. With this vaccine, it only requires the one shot, and of significance, it doesn't require special refrigeration for shipment and storage. It's highly effective overall in preventing moderate to severe COVID-19 diseases, and now that we have 3 approved vaccines, and even a 4th is under development, and that's the AstraZeneca, but that is still somewhat controversial and has not been approved yet. But the important thing is that the gap between supply and demand for the vaccine is narrowing and very encouraging at this point. There are variants of servicing, of course, and the total impact of the variants is not yet known. It could become a very major problem, but it requires more research to determine what the problems are with that. But they are known to be more contagious than the original viruses. They transmit it at a higher rate. As a result, more people get infected, more hospitalizations, and regrettably more deaths. There's speculation that the United Kingdom variant may become the predominant strain in March. The projection for when the general population can obtain the vaccination recently improved. It is now again projected to be in the May-July timeframe of this year. President Biden has recently announced that the United States will have enough vaccines for every adult by the end of May. He has also made a goal of vaccinations for all teachers in the month of May. And while we are in this pandemic, and will be for some time, the federal government has confirmed that the vaccines are available to those in need at no cost to the individual. The supply and vaccines and the distribution has improved significantly and is helping meeting demand. Excuse me. But it is estimated that it takes approximately 75 to 85% of the populace being vaccinated to achieve herd immunity. And the effectiveness of the vaccines will be minimized if large numbers refuse the vaccination, but the trend appears that more people are receptive to the vaccination than they were before. There are a number of people who are asymptomatic. They have the disease, the virus within them, but they don't know it. They don't show outward symptoms. But unfortunately, they do have it, and it can infect others and transmit it to others, causing illness and, in some cases, death. The governor reaffirmed recently, in accordance with his last proclamation, that even though there's a bunch of new categories and there's some easing of the ability for older people, grandparents, to visit with their grandchildren and things like that, it's still in the proclamation that every individual in Louisiana age 8 or older shall wear a face covering over their nose and mouth when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors, and this includes public or commercial modes of transportation. The Center for Disease Control now also recommends that children aged 2 to 7 wear masks, but that's just a recommendation. The CDC has also released very recently some relaxed guidelines, what I just alluded to, with regard to persons who have completed their vaccinations and gone through a 14-day period following that. They could now visit with their family members, some of which may not be vaccinated, but if it's just their own family members, then they can visit with them without wearing the mask and social distancing. More to come on this as it gets a little clearer when we get the guidance from above on that. As previously announced, the Center for Disease Control and the Louisiana Department of Health has determined that the number of days a person should remain in quarantine can be shortened to 10 days on the 11th day if no symptoms have been reported during the daily monitoring period. They've also said it can be shortened to 7 days on day 8 if the individual takes the COVID-19 test and receives a negative result. It's hoped that these shorter quarantine periods will encourage more people to receive the vaccination. However, the Louisiana Department of Health does say the 14-day quarantine requirement still exists for residents and staff of congregate living facilities, such things as nursing homes and correctional facilities. Ladies and gentlemen, the prevention and mitigation protocols are still unchanged. They're the things we should do to try to continue to bring this pandemic under control. They start with very important, continuing to wear the mask. Sometimes you may be in an area where it's not required, but it's still recommended. Washing your hands for 20 seconds is still recommended. Social distancing of 6 feet or more is still recommended. Try not to touch your face. Clean, disinfect surfaces such as doorknobs, handrails. Cough or sneeze into the bend of your elbow. And if you're sick, stay home and follow the advice of your medical provider. and as always, avoid crowds. Ladies and gentlemen, the pandemic is not over. We now have three vaccines available, and they are beginning to make a significant and positive difference, but the challenge remains, and it's going to take all of us continuing to work together to survive this pandemic and return to a new normal in our daily lives. I want to thank all of you for your continuing positive involvement in our fight against this deadly pandemic, and just remind you that although there is a light at the end of the tunnel, we're not through the tunnel yet. Our next scheduled briefing will be Thursday, March 18th, and this concludes our briefing for today. I thank you, and good day.